Hello, good evening. My name is Nancy Orumense. I'm a student of Suffolk University, studying Health and Social Care Level 3. And today I'll be discussing a very important topic about communication. Communication is very vital in the health and social care sector. It's important that we use the right communication styles and form to communicate with resident users and our colleagues and their families. So today I'm going to be focusing more on the style of communication, which is assertive communication. This presentation will look at what assertive communication is and why it is useful and the challenges of using it and how it can be adapted to support person-centered care. What is assertive communication? Assertive communication is when a person expresses their thoughts, feelings, and needs clearly and confidently while also respecting others. It involves being honest without being aggressive or passive. The key characteristics of assertive communication includes clear speech, a calm and respectful tone, a good eye contact and positive body language, and active listening is required in assertive communication. This style helps ensure that both the professional and the service user feel respected while passing while doing their respective duties and role to their patient. Now let's have a look at the strengths of assertive communication. One main strength of assertive communication is that it allows clear and accurate information to be shared. This is important in health and social care to reduce misunderstanding that often happens in this sector. It also helps build trust between professionals and service users. Assertive communication encourages service users to ask questions and be involved in decision making that concerns their health and things related to that. It also supports teamwork as staff members can share concerns and ideas confidently and respectfully. Now let's have a look at the next slide, slide 5. Limitations of assertive communication. What are the limitations? Some of the limitations could be um, this could be it has some form of, let me say, some people can perceive assertive communication in the form of, oh, this person is rude, or they might find it like, oh, why is she talking like that. They might not be very comfortable with it. And others could be cultural differences, like some people might not be comfortable when you talk so professional to them, because some ways of talking can send different signal or meaning, depending on the culture people come from. And other limitations here can also be difficulty to use assertive communication in emotional situations, such as when a service user is upset or distressed. Like, it's really difficult to use assertive communication for a service user who is annoyed, who is upset, who is angry, who is aggressive. It doesn't really work at this stage. Other form of communication has to be used in this kind of situation. um Assertive communication can also be misunderstood when it's being used between for example, between senior carers and a carer. So it could be, oh, they are authoritative, or they are proving to be more educated, or things like that. So it can be misunderstood. So these are some of the limitations of assertive communication. Now let's go to the next slide, slide 6. Application in practice. Assertive communication is used in many health and social care situations. For example, a nurse may assertively explain treatment to a patient while listening to their concerns. A care worker may report safety concerns to a manager in a clear and respectful way. In multidisciplinary team meetings, professionals can share opinions confidently while respecting others. This helps ensure that care plans meet individual needs and support person-centered care. Now let's have a look at slide 7, adapting assertive communication. How can assertive communication be adapted? It can be adapted to suit different individuals and situations. For example, a professional may need to use simpler language with people who have learning difficulties or speak English as their second language. So if someone doesn't really understand good English, in this case you need to use a simple English, simple vocabulary, find a simple way to talk so they can be able to follow it up and understand and be able to participate. So the other one is empathy and patience are important when communicating with vulnerable individuals. So if you have someone who has difficulty, a learning difficulty, or people with SEND, autism, so a different form of communication is needed. You can't use assertive communication through with this kind of people. So non-verbal communication such as social expressions and body language should match what is being said. So you can't be saying something assertively and then your body language doesn't suit what you're saying. So your body language should correspond to exactly what you are saying. Yeah, like you're telling a service user, oh, I'm feeling great, I'm not tired, and then you're looking like really weak and all of that. So it doesn't work that way. Adapting communication helps ensure it remains respectful and effective. So it helps to make sure communication is respectful and effective. Now let's go to slide 8, improvement strategies. What are ways we can improve? There are several ways to improve assertive communication skills. 1, training workshops can help professionals practice assertive communication. So workshops can help, training can help. Reflective practices can also allow individuals to think about how they communicate and how they can improve. And then if you have the opportunity going to workshop, you can play activities. This can also help to improve on your assertive communication. Receiving feedback from colleagues can also help to improve and support person-centered personal development in improving assertive communication. Now slide 9, reflection and conclusion. Well, in this topic of assertive communication, I have learned, and I've also, this is my reflection through this assignment. I have learned that assertive communication is essential in health and social care. It's very important, this form of communication. It helps professionals communicate clearly, set boundaries, and support person-centered care. I now understand the importance of adapting my communication style to suit different persons, individual, depending on their needs, depending on their situation, and all of that. In my future practice, I will aim to use assertive communication to improve teamwork, build trust, and provide better care outcome. Thank you very much. So now let's go to slide 10. Slide 10, you will find the references, places where I got all my information from. So thank you for listening. Thank you so much. Until next time.